Hey everybody, I'm Dr. John Willardsen, and we're here in beautiful Newport Beach, and today we've got another great live stream today for you. And we're going to kind of delve into some topics that are kind of we see a lot of. And of course, I'm here with Memo Hea, who's here to support and is behind the scenes the guy that runs everything. So. But today I'd like to look at some cases, and these are patients, and also talk about kind of what led some of these patients into these situations and the way out. And really here in our practice, we see a lot of, first of all, any medication has a tremendous effect on our teeth. And like I've said in some of my other podcasts or live streams, our teeth is kind of a look into a really quick, fast look into our overall health, and not just our systemic health, but our mental health, our physical health, and in reality, our mouth and our teeth are a really quick view of what's going on in the lives and in the world of this patient. And we see this a lot because we see it from the point of where they come in and it's a absolute train wreck to the point to where it's restored. And when restored, their mindset shifts. So we're going to be looking at patients who have been addicted to different drugs, whether it's meth or opiates or whatever the case may be. And they've taken the steps to start the process to restore their life. So, and it is a process. It doesn't just happen overnight. People who struggle with addictions and that sort of thing, it's more of a journey rather than it's kind of a roller coaster effect. But we find that once a patient fixes their teeth, because what happens is let's say, for example, with methamphetamines, their mouth becomes so dry that within a couple of years, their teeth are just destroyed. So, and of course, at that point, they're not really maintaining them. They're not brushing. They're just they've kind of just given up, a lot of times given up on life, or the drug is their main drive, and that is all they think about, so they neglect everything else or other things. And it's oftentimes, and usually 90% of the time, it manifests in the mouth. And so we see these patients come in and we have a lot of compassion for them. We know that once their mouth is restored and they restore that confidence and regain that confidence, that the process of healing really is starting. So let's take a look. You can kind of see my screen over here, but we'll look at some photos here. Again, he had some crowns done, but underneath all of these crowns was all decayed. But notice the bottom teeth completely just rotted out. And again, it has to do with the fact that it's a very dry environment, especially with meth. And once the enamel has been broken through with decay, the dentin, like we talked about, I think in our last live stream, it goes real fast. The breakdown of the dentin, it's a lot softer than the enamel, of course. And so another case, similar situation, teeth have broken off at the gum line. There's decay in the dentin, or in the tooth, missing a lot of teeth. So he has a lot of factors. One is the fact that the mechanics is no good. He's only chewing on that one front tooth. And then also just the fact that with the history and use of methamphetamines, there's a lot of decay, broken teeth, and then you break one tooth and then another, and pretty soon you're in a situation where the whole thing has to be reconstructed. This is kind of a combination of periodontal disease, but also with methamphetamines. But, I can show literally thousands of photos. Same thing here. Broken teeth at the gum line, history of drug use. And, as a result, can you imagine for those who have not experienced or been through this, or don't have this issue, I guess I would say. Can you imagine what it would feel like to wake up every morning and have this as, when you look in the mirror, this is what you see. And so, again, it's that breakthrough the enamel, and then once it gets into the dentin, it's a rapid process where the teeth really start to break down. And once it gets to a certain point, like in this case here, there's just, he's got teeth. He can probably chew fairly decently, but, there's just not much left to save here. It's all just rotten, decayed, and removing the roots is the best thing. The gum tissue is actually fairly healthy in his case, but there's just a lot of decay. So, anyways, so
Doctor,
yeah,
we have a question in the comment section going along with what you're showing. It says, "Good morning, Dr. Willardsen. Would an addict have to quit once dental implants are in place? How would it affect the dental implants?"
Oh, great question. So, again, would they have to quit? I would say yes. Do have cases where the patients we've done the entire case and they have relapsed, and fortunately the implants are not as susceptible to what we're seeing, like in this case here, where the decay, the breakdown of the tooth. But the problem is it's not so much that the implants, they are less susceptible to breakdown, but it's the neglect, it's the mindset, it's the, because if you neglect implants and you don't brush and you don't maintain, you're going to end up with periimplantitis, or there's inflammation around the implant. So it's best, and we've found that most patients will, usually they stop because it's been a process for them, so that they've had to kind of work for it. And then once that part of their life is restored, it truly is a game changer for them. Here's a case of cocaine can have that's a drug where you don't physically see the effects until it's too late, and everything is going through the nasal cavity and the posterior maxilla, and so anyways, lots of different scenarios, and they're kind of gross. But the point is we take patients who have been in situation. This young man here was on the streets, homeless, addicted to meth, just a wonderful guy, could not be a more gentle soul. And a lot of times it's those guys that end up on drugs. The world just kind of beats them up and they just give up. So but here he is before, and I'm not going to show like inside his mouth because there's a lot of decay, a lot of broken teeth, and it's just pretty much everything needs to come out. But here he is after. So, just look at the difference, not just, I think he was probably either coming off of something in this photo. You can kind of see it in his eyes. And then here, he looks like a different person. I'm pretty sure he's pretty clean right here. It's and again, it's having those teeth back. And he would say that, when he started losing teeth and once his teeth were gone, he just gave up. And in fact, that's not why he ended up homeless, but it was certainly a part of the process. Waking up every morning, looking in the mirror, and then just having that addiction just take over your life and just feeling like, what's the point? So that's kind of a little bit of a heavy subject. But now, and we've got some So here's a case where, again, this is a patient who is addicted to meth. I mean, there's just nothing left really to save here. I mean, it's a matter of, okay, where do we begin? It's like a bomb went off in their mouth. But fortunately, this is a remarkable case, actually. He completely transformed and changed his life.
I had been addicted to methamphetamine for about 8 years, and towards the end of my addiction, pretty much all my teeth were gone. I even had a gap in the front right here that just, you could fit a Tic Tac through it. It was ridiculous, and they were falling out. And my self-esteem was non-existent. I had gone to that point where I had become homeless, and I just had no confidence in really just talking to people. I always isolated myself. I'd kind of just stay away from people. I even tried looking for a job once, and that didn't go very well, But I went into a program for a year, and towards the end of that program, after losing 70 pounds and finding the right way and getting situated back into a new life, I started looking at options for getting my teeth fixed. And my mom had mentioned Dr. Willardsen over here, and he showed me what I could be, what I could become. He showed me before and afters, this is what we've done for other people, and I really wanted it bad, I wanted a normal life, because again, I had been isolating myself and just staying away from people, just because even from the pandemic, the masks were actually a blessing to me. I could actually cover myself. I actually enjoyed wearing the mask. And so, there were times where I'd be talking to somebody and I'd always see their eyes shift downward towards my mouth. And it's such a huge distraction. And so I did the evaluation here, and, I came in, got the procedure done. I think it was a 4-hour procedure. I was asleep, woke up, and I looked in the mirror, and I couldn't believe it. I couldn't believe it. And the past couple of weeks, I've just been really enjoying talking to people. It has been a total life change, and I can't stop smiling. And it's an amazing feeling to not have that stigma on me. Oh, this guy he's a drug user, And I put that behind me now, and I can move forward with my life and just have a normal life. So I'm very thankful for Dr. Willardsen. As well, a side note is that he actually was very helpful with the payment. He was very willing to work with us to get this procedure done. So I'm very thankful for it. Dr. Willardsen in the office, all of his staff here are super helpful. Every time I had an issue, it was always immediately addressed and resolved. The staff here is really on point. I'm thankful that they comforted me through the entire process. Even when I was being very flaky with just getting the second implant done, I had canceled several times, but they're still being very cooperative and supportive and helping me come back and get the procedure done. And I came back, and again, super helpful. And they really gave me a new life. So.
Yeah, again, we have many cases, many patients, similar situations as that, lots of testimonials. There's another one here. We won't go into it, but you can watch it on our channel, on our YouTube channel, or on Instagram. But, a lot of patients who have been in similar situations that have restored their lives and are now in recovery. And fixing their teeth was a big part of this process. I can only say that because I saw it. I watched them transform from when I first met them, almost defeated, deflated, felt like there was no hope. And And then when we were finished, and it wasn't because of my work, it was because of their work, it was because of their willingness, their sacrifice. Not one of these individuals came in with a bag of cash, right? I mean, every single one of them had to make it a priority and find the means in order to get, to pay for their work. And so, it's a really wonderful thing to watch. So,
Dr. Willardsen, if you wouldn't have said that story about those two, I wouldn't have imagined that they went through what they went through. Like, they look like this last guy, I forget his name.
Griffin.
Griffin.
Oh, Josh.
Yeah, Josh, he looks like he never went through what he went through. He looks good, clean, nice smile. He's smiling.
Yeah.
They both look great.
Yeah, it's amazing because, again, like I said, I just saw Josh a couple of days ago, and I mean, I literally thought in fact, it's funny because he was with his mom, and I think they'd gone to Starbucks or something before, and somebody in line asked him if he was, the CEO of a company, and that's why I said that, because they literally asked him, "So are you a CEO?" Because he was kind of, he's dressed up real nice and he looks good, and so complete 180 from when we first met Josh, and he was in that situation, like like you said, he was homeless, and so now let's move on. So because these are pretty extreme scenarios. Life got the best of gets the best of all of us. It gets the best of me. It gets the best of everybody, right? And so we have to find things that help us to clear our minds. Life gets very stressful. And so I just want to kind of go into, some things that I use personally to keep my mind right and to stay focused. I'll show some pictures of, I love to ride my mountain bike. So last weekend, or I guess it was 2 weekends ago, I was in Montana, and just those 2 days being, in a beautiful place, recreating, exercising, clearing my mind, it just helps to, this place is so incredibly beautiful, so this is climbing up to the top of the ski resort on a mountain bike. But the exertion, the beauty, recognizing God's hand in everything, knowing that I have the energy to climb this hill, all of these things kind of help get our minds right. And a lot of times, and I see it in some of the patients that we see that get into some of these addictions, they don't have a release. They have nothing to help them to get out of their head in order to, so then they turn to drugs. So, and, I was going to ask, Memo, what are some things that you do? Because I know your life is filled with stress. You get up at 4 a.m. and do, trading in Forex, and then you're here all day long, and then you don't leave here till 7 at night. And then it's back to the same grind every single day. What are some things that you do to keep your mind right, to try to stay focused? And
Yeah, of course. Well, just kind of like you're saying, doctor, just getting out. I feel like nowadays, like even here, like you said, I spend a lot of times in front of the computer, and even in the morning when I'm up trading, and just taking the time to go out and like you're saying, like see nature and try to make that a habit. I feel like life, we have either good habits and bad habits, so we have to fill our lives with good habits, and maybe not right away, but we'll start with something simple, like maybe go for a walk every day, or like go for a short run. It doesn't have to be like go to the gym twice a day,
Right.
or something like that. Or even like if you can't like start with the habit like that, just like the habit of just drinking an X amount of water every day, just start building those habits, because then those habits are going to turn into just bigger.
A lifestyle, right?
A lifestyle, yeah. Or like you're going to add good habits, you're going to continue to add those, and then the bad ones are going to eventually go away because you only have so much time in the day. Yeah. And I would say, yeah, for me, it's just that, building those little habits.
Yeah, I love that. Just because I'm kind of, extreme. I either go to the gym and it's, I go every single day. I'm there for 2 hours. I'm just grinding. But if I don't, I don't do anything. So I love the idea of just whether it's go for a walk. I mean, and that seems like, well, I'm not really working out or I'm not doing anything. But in reality, it does make a difference. Or drinking more water throughout the day, finding those things that help to, again, you've got good choices and you have bad choices. And if we can lean more towards the choices that are good and then add to those every single day, it just improves our lives. And the only reason I bring this up is because, unfortunately for so many out there, the bad habits can overtake us and they can cause us a lot of pain and suffering, and the recovery to come back is so tough. So if we can, like Memo was saying, if we can take just those simple steps every single day, take one step and then another step and another step towards the good, then eventually our lives are kind of filled more with good rather than on the opposite side. If we just choose things that will break us down, we cannot win the battle of, being, you can win, but it's a constant fight, being addicted to something or having some stories like these young men have had. It's a constant battle and it's something that'll always be there. So we have to fill our lives and try to fill our lives. And I'm not preaching. I'm just saying because we see the negative effects. I mean, can you imagine being homeless? And one of these guys was homeless in Salt Lake City. Salt Lake City in February is about 20 to 10 to 20 degrees downtown Salt Lake City. So, not a good place to be. But but choosing those good things every single day to try to improve our lives. And again, we see this because the mouth manifests so much, whether it's psychological, whether it's nutritional, whether it's systemic disease. There's so many things that are manifested through the mouth that we see here. But the beauty is we can fix so much. I mean, the beauty of dental implants is the fact that I can pull the teeth out and I can put implants in because the bone is still viable. It's still, for the most part, the bone can handle the implant and the implant can support the teeth that are lost. So, so that, there's a second, third chance there, right? And so we, just making those choices, choosing something every single day to keep yourself on the right track and keep that grind and keep that fight up, So
yeah, doctor, I have a couple more questions in the comments. One of them is, what other factors can cause factors can cause periodontal disease besides drug addiction?
Oh, wonderful question. So periodontal disease is a patient may not be addicted to something, but periodontal disease is also very insidious, meaning that if you don't, it's like, let's see, I mean, anything, whether it's your car, whether it's your house, your room, like Jordan Peterson says, you just got to clean up your own room, clean your own room up, right? If you neglect anything, I mean, I'm probably on the side of, and it's usually due to the lack of time. It's not the desire, but sometimes my room usually stays pretty clean, but my closet can become a disaster because I come in from the office, take my scrubs off, throw them in the where the dirty clothes go, take the clothes off, or take the clothes that I was wearing the day before, because my kids, my wife give me a hard time that I wear the same clothes every day. It's because I only wear them for 2 or 3 hours a day because I'm in scrubs all day long. So I go home and I wear the same pair of pants, but those pants are only worn for 3 or 4 hours. So to me, what's the point of washing a pair of pants that have only been worn for 3 hours? So but my point is I can be very disorganized when it comes to that, because so much of my focus is here. And so a lot of things get neglected, and I feel bad about that. But again, like you're saying, Mem, I only have so much time. I kind of got distracted there. But so periodontal disease it's very insidious. It comes on if the patient isn't maintaining brushing, flossing, maintaining their teeth. Without a doubt, you will get periodontal disease, because bacteria, tartar, calculus builds up on the tooth. And then it's a matter, and again, that's an acidic environment. And once that bacteria and debris is adhered or attached to the tooth, that acid that starts to generate just starts to eat away at the tissue and the bone. And eventually, so they don't necessarily have to be an addict, but they may be kind of leaning towards somebody that has also given up, oftentimes. Anyways, but yeah, periodontal disease is definitely a factor in losing your teeth, for sure. So
along with that question, if left untreated, can periodontal disease or other oral infections spread to the rest of the body?
Yes. So if periodontal disease is left untreated, and there are different levels of periodontal disease, and so, a pretty severe level of periodontal disease is the body is constantly fighting off the infection. It's trying to get rid of the cause of the infection. And whether it's whether it's a splinter in your finger or bacteria on a tooth, the body's going to build a well of infection around whatever it is, and that is how the body excretes or gets rid of whatever is causing the infection. So if it's a tooth, the body's going to try to get rid of a tooth. If it's an implant that gets infected, the body's going to build infection around the implant, and it's going to try to eliminate the implant. Or if it's a sliver in your finger, you're going to get a well of infection around that sliver and that's how the body excretes or eliminates the causative factor, the thing that's causing the infection. So periodontal disease can definitely and will, without a doubt, cause tooth loss if not treated, and if it's gone far enough. And in fact, I thought I had some photos here, but maybe not, and we're running out of time. But if left untreated, let's see, the bone will run along to the point where there's just not any bone supporting the tooth anymore. The tooth becomes loose or mobile, and then it falls out. And it's usually multiple teeth, so it's not just one tooth. So but anyways, find ways to recreate. Look at this picture. I mean, that clears my head real quick. Give me one day in the mountains in the snow, and I'm a happy camper. And find those things that help you to, like Memo was saying, and start with baby steps. Drinking more water, or getting up an hour earlier, or working out. If you're not working out at all, start with 10 minutes, 20 minutes, whatever it is, to avoid falling into the side of, and it doesn't have to be drug addiction, but it can be food addiction. It can be, who knows what it is, Starbucks addiction. There are so many things that the world is throwing at us to make us unhealthy, and we have to make the conscious decision to do things to help our minds be sane and sound, our bodies clean, our minds clean, so that we can, when we wake up in the morning, we're ready to go, and we can, not conquer the world, but definitely make a dramatic effect, because we are each of us has the light of Christ in us. We can either diminish that light by not doing things that help it to grow, or we can do things to help that light grow by doing good every day. So anyways, thank you guys for watching. Are there any other questions? One last question. Okay.
Do you offer financial aid for dental implants?
Yeah, another good question. So again, I've shown you patients and cases. Not one of these guys, had a lot of money to do their work, but it was a priority for them. They found a way to get it done, and they just made it a priority. In fact, one of them had saved for 6 years. But to answer the question, we do offer financing. You're going to see ads, misleading ads out there about free dental implants or dental implants for $399. Just do your homework, be aware, be cautious. Nothing's free, especially a situation like these cases we've shown. There is a cost involved. It's an investment. It's a sacrifice. But one that's not out of it's not out of reach for anybody. Anybody can afford to do this procedure, but it has to be a priority, and there's going to have to be maybe some lifestyle changes in order to make that happen. But we've seen the beautiful, life-changing results, not just aesthetics. Of course, it looks good. Aesthetically, it looks good, but it's transformed their life. So whether you're in a situation where you're losing teeth, or if you are in a situation of an addiction and causing breakdown of your mouth, whatever the case may be, we outlive our teeth. That's just the way it is, unless certain individuals with really, really good genes are, live without losing many teeth. But for the most part, people lose teeth. And by the time they're 40 to 70 years old, they're losing a lot of teeth. So anyways, again, every day make choices to bring in that light and to maintain your teeth as much as you can. And if you are losing your teeth, get them fixed, because it makes all the difference in the world. I'm Dr. Willardsen. Thank you guys for watching. Stay tuned next week. We'll be doing another live stream. Make sure and hit that subscribe, like button. It helps us with with our YouTube algorithms, and we'll try to keep our content a little more light, and of course, talking about the implant side of things. But again, there's so many things that we see here in the practice with each of our patients and their lives, and I know we have a lot to share. So thank you guys for watching, and we look forward to next week. I'm Dr. Willardsen, and have a great week.